Hi, this is Dr. Christopher Wellwood with the Regenerative Medicine Institute. Today we're going to talk about a technique that we don't use as often here at the RMI, mainly because the effective rate isn't as high as the other three injection techniques that we use, and that would be platelet-rich plasma, or PRP. PRP is huge in regenerative orthopedics. It seems like any doctor out there who has gone through a weekend seminar describes themselves as a PRP expert. I was trained by one of the foremost providers of PRP, and I learned my ultrasound guided injections with that, and his name's Joel Baumgartner out of Minnesota. So my training in PRP has been absolutely amazing. However, also, even though it's been amazing, it doesn't work as well as prolozone or prolotherapy or neuroprolotherapy. PRP itself is basically taking a vial or blood out of your system, spinning it down, taking the white buffy coat in there, so that's the platelets, and injecting that into a very specific part of the body that's been damaged and is not healing very well, and hopefully increasing growth hormone and then repairing the actual tissue itself. Sounds wonderful, doesn't it? Using your own tissues to actually rebuild your own tissues. There's a couple things that are wrong with that. One, if you're a Jehovah's Witness, you cannot do this. It is taking blood out and putting it back in. Two, it's only about 60% effective. So whereas prolozone is 85 and sometimes 95% effective, prolotherapy is about 70-75% effective, neuroprolotherapy is again 75 to 80% effective, this one's only about 60%. Wouldn't be so bad, but it's also 3 times the cost. So where I would do an injection on the lower back or even the knee for a prolotherapy or comprehensive prolozone, and it might cost a couple $100. PRP, because the kits are so expensive, is going to cost upwards of $700 to $800. If I were to do a spine, it's around $1,200. Now, we're lucky enough that sometimes these treatments are covered by insurance, but oftentimes they are not, which basically means that you get 60% improvement up to, and we have to keep on repeatedly doing that about every 6 weeks or so until you're absolutely stabilized. Now, another bad thing is that when we do the injection, you cannot move that area at all for about 10 to 14 days because we want to approximate tissues. We want to bring them together. So you are basically in a splint of some sort or a brace for 10 to 14 days. That also means no exercising, and oftentimes for people in chronic pain, it also means no working out, no working at all, and a pretty poor life for a period of 10 to 14 days with a lot of pain. So those are the reasons that we don't typically do those here. However, we do have the equipment, and oftentimes people come in specifically for PRP. So do I recommend it? Sometimes, if we're talking about a sports injury. Do I perform it? Absolutely, because it does work on some people. If the prolozone doesn't work or the prolotherapy doesn't work, then oftentimes we'll start the PRP. So if this is interesting to you, please send us a comment back. If you have any more questions about how PRP or its treatments or any of the alternatives can actually help you, don't hesitate to give me a call at 509-299-6900. I'll talk to you soon.